Hi, my name is Adebayo Christopher Adedoyin. I'm an anesthetic technician and also I supply anesthetic consumables to Nigeria Hospital. Today we are going to be discussing fiber optic laryngoscope. Remember, during my last video, we discussed laryngoscope in full details, in which I told you that there are three types of laryngoscope. We have the standard laryngoscope, the fiber optic, and the video laryngoscope. And also remember that I explained the standard laryngoscope in full details. So please, if you know you have not watched the video, please, I will beg you, go and watch it, because there are a lot of stuff that you can actually pick from that video. Now, what is fiber optic laryngoscope? Fiber optic laryngoscope, it is a medical device that is used as an adjunct for difficult intubation, especially in anesthesia and intensive care units. It is a light generated medical device that is being transmitted through a glass fiber, and this makes it as an ideal device for difficult intubation because it provides a forensic view during laryngoscopy. Now, this device has three basic functions, which are airway evaluation, tracheobronchial toileting, and intubation. Now, what is intubation? Intubation is a medical procedure which involves the introduction of endotracheal tube into the airway or into the trachea. But there are some certain times in which the anesthetics find it difficult to introduce the tube into the airway, either as a result of obesity, Mampathy 3 and 4, large neck circumference, short neck patient, and small mouth opening. So this, when this occur, the anesthetic we order for the fiber optic laryngoscope, because why? It has a camera that help to capture the airway as you advance or as you advance through. So this make it easier for the larynx to be viewed by the anesthetics. Now, the other one, which is the airway evaluation. During airway evaluation, we evaluate the airway for tumor, for infection, for tube placement. That's used, which is endotracheal toileting. It is a medical procedure which involves the suctioning of the airway system. So we suction the airway for foreign bodies like the mucus, like the sputum, and this is important during ventilation because when this is not being suctioned, it can occlude the airway, especially during ventilation. So these are the reasons why this device is very important. Three uses that I've said so far, which are the airway evaluation, intubation, and tracheobronchial toileting. Now, what are the various components of this device? This device has a lot of components, and the components are all important, especially during use. The first one is the control knob, the eyepiece or the camera head, the light source, the flexible shaft, and the tips. So these are the various components. Please, I have the diagram of this device here. Let me bring it out so that we all know what I'm talking about. All right, this is the fiber optic laryngoscope. This is the tip. This is the flexible shaft. This is the suction channel. This is the light source. This is the control knob. The control knob helps to control the tip of the device. And mind you that the tip of the device does not move in a 360 degree, but rather it moves anteriorly and posteriorly, meaning back and forth. Light source is a point where the light is being generated, the light source. While the suction channel is a point where the airway can be suctioned because it provides a tube through which you can suction the airway, especially during intubation. The flexible shaft helps in the easy placement of the tube into the airway. So this is the control knob. This is the suction channel. This is the light source. This is the working channel port. And lastly, this is the flexible channel. So these are the various components of this medical device. Now, please note, this device can be inserted even when the patient is awake or even when the patient is being sedated. Please note that the device can either be inserted orally or nasally. These are the things that you need to know about fiber optic laryngoscope. So thank you for watching my video today. If you know that you have not subscribed to my YouTube channel, so please do subscribe because there are a lot of things that But there are a lot of videos that I do release on a weekly basis so that you will not miss out from any of these videos. Thank you for watching. And please note, I supply anesthetic consumables to Nigeria hospitals in case maybe you need my services. So please, you can easily reach out to me on 07063712393. Thank you very much for watching. God bless you. See you in my next video.